afternoon, everybody. Today we're going to talk a little bit about telehealth, and it's two of the presenters. I'm going to introduce Scott. He is with Corvell, and Sherry. They're both with Corvell. So they're going to talk about the program. GMA decided to implement a telehealth program back last summer, and we've had some pretty good results with it. And we're going to talk to you about how it works, what you can expect, and hopefully everybody's going to give it a try. So Scott, you want to start out?
Absolutely. Thank you very much, Brenda. And thank you all for taking some time this afternoon to join us for a subject that is really was in theory many years ago. Now it's something that we're passionate about here at Corvell. And so what can you expect to get out of this presentation today? We want you to understand what telemedicine feels like, what it looks like. We'll go through some of the logistics of that, what your injured workers could expect, and what they would be required to do as well. And we're going to talk about how it benefits the members. But more importantly, it's going to be a good experience for your injured workers, making certain that they get the right care at the right time immediately. And it's truly remarkable when you think about technology, where we are in the world now. I want you to think about maybe just one piece of technology that all of us can't live without right now. I'll use the phone as an illustration, the smartphone. Maybe 10 or 15 years ago, many of us had a flip phone, and we used the phone just to call people, to text, and it was really cumbersome. But now think about your smartphone. I think about 70% of Americans have a smartphone as a possession. We are connected now. We text all the time. We can video chat. We're connected to our family. We're connected to individuals at work, emails. We can find answers to almost anything. So technology is playing a role in our lives. And so why not take that technology platform and really affect better outcomes when it comes to the care of your injured worker? So as Dan mentioned before, we want this to be interactive. We realize it's mid-afternoon. We want to keep you awake, make certain that you're not drifting off. So we've got a few questions, but one of the things I wanted you to know that in 2019, Corvell performed over 10,000 telemedicine visits. In 2020, we're on pace to do over 30,000. And I read a report in NCCI that by the year 2025, virtual visits are going to outpace brick and mortar visits. So it is the future. And maybe some of you have used it on the group health side, or I've had family members use it on the group health side for their work. And it is really a good experience as well. So one of the questions I have for you as we get into what we're going to talk about is, do you remember there was a cartoon in the 1960s that featured a family that lived in the year 2062? And that family had access to the latest and greatest technology of the future. Anybody out there, you could type it in or raise your hand. Do you remember what cartoon featured this family that lived in the future?
We got an answer from Blair. The Jetsons, question mark?
Hey, you got it. Blair, if you were here, we'd be giving you a prize. Awesome job on that. And you're right, it was the Jetsons. And if you look at this slide that's on here, they had a robot maid, they had flying cars, but if you look closely at the illustration, this was from one of the cartoon episodes when the young boy was sick. There was the thought that by the year 2062, doctors can do a telemedicine visit and do an exam of someone and prescribe medication or whatever's needed. Well, it's not the year 2062. It's 2020, and this is taking place. So it's pretty exciting to see where we are and how we can really adopt this as well. What I'd like to do is I'm going to hand it over to Sherry to talk about industry trends. And Sherry, go ahead.
Thank you, Scott, and good afternoon, everyone. I have a question for you as well. What was the first government agency to embrace and implement telemedicine? And it was purely out of necessity. Do the little Jeopardy talk or anything?
I don't have any answers yet.
Could be. Here's a visual.
The rocket ship. NASA. So if you think about it, that was the way of bringing healthcare and medical care to the astronauts when they were in space. So that was 50 years ago. Here we are in the present in terms of telemedicine, and there are two primary driving factors for telemedicine over the last 50 years, and even where we are today and looking forward. The first would be for rural communities, in that there are limited care providers or limited access perhaps. So telemedicine has been a medium for healthcare for those small towns, which we know there are several in Georgia and certainly across the country, as a way for folks to have access to medical care. The second is convenience. And from that perspective, everybody certainly enjoys the benefit of convenience, of saving time, and particularly in areas that might be more congested. You have traffic, you have parking, you have wait times in provider offices. So telemedicine provides an opportunity in order to just absolutely eliminate that. As we look forward in terms of the trends, there are several factors that are also contributing to the growth of telemedicine. One would be mobile adoption. As Scott mentioned, literally our phones can do just about everything now. Secondly, we also have a mandate for electronic medical records. I think most of us are seeing that our physicians have moved. We might have the little iPad kind of things to sign in on when we get to the doctor's office. So the realm of telemedicine already provides for an electronic record. So we have the combination of those two, and then as well as just the absolute desire for convenience. So the three of those working together certainly support just the trend of where we're going, as Scott mentioned, what we're seeing at Corvell, and certainly what a lot of the group health providers have been seeing for the last 5 to 10 years.
Well, thank you very much, Sherry. And I think the next slide, we'd like to talk a little bit about. Dan, can you go to the next slide?
Yep. Does that work?
I still see the previous slide.
Okay, listen.
Oh, there we go. Got it. Oh, excellent. Thank you.
You can actually keep clicking through this. Oh, Scott's got it.
Okay, got it. Many of you are familiar with the Corvell 24/7 Nurse Call Center, and you can see that starting on the left. The purpose of this slide is really showing how Corvell and for GMA members is really redefining and reimagining the intake method. And I'll just hit a couple, then I'll toss it back to Sherry. But when something happens at work, having a nurse answer the phone, especially if someone is alone, they have that reassurance that they're talking to a certified nurse that can take information. And we're really trying to get them the right care at the right time, as we talked about before. But I'll throw it to Sherry as far as the flow of this chart and what we're doing.
Thank you, Scott. One opportunity that we have here to illustrate, perhaps for some of the members that are newer, our approach truly is one of advocacy and of care sooner than later. So in effect, you have claims and healthcare running in tandem, and we have found that it is 1% or less of the claims that come in are denied. So this provides everyone the opportunity to give the injured worker access to the care that they need, so that they might be able to stay at work or certainly have a speedier recovery. So our telehealth model is a little different than group health, where in group health, you can pick up the phone and call Blue Cross Blue Shield and speak directly with a doctor. The Corvell model is based on going through the 24/7 nurse call center. So this provides an opportunity to really identify the situation, and then what is the appropriate level of care. It might be that telemedicine is not the appropriate medium, that in fact that injured worker does need to go to a brick and mortar. Or on the other side, maybe it's just first aid. So by having the nurse intervene first, there's that initial sense of holding hand. And if by following a protocol, it is identified that telehealth could be a really effective medium, the nurse gives that injured worker an opportunity to say yes or no. No one is forced to partake in telehealth by any means. And if they say yes, the nurse actually transfers that injured worker over to speak with a concierge agent. and they will help them make sure all the technology is in place and set the appointment generally in 5 to 10 minutes to be able to speak with the provider. And I think Scott will cover more on that as well. So the other component, if you kind of think of both sides of medical care, there's the access to the care, receiving it, but there's the treatment aspect. And in the past, what could have presented an effective telehealth visit would have been not having access to diagnostics, physical therapy, or possibly even the communication and follow up on work restrictions. So the CorVel telehealth model and our group of physicians is fully connected into all of those services. They can make those referral appointments immediately, and they can also be sending out work restrictions. Similarly, we can offer follow-ups so that the physicians can determine how the restrictions are working. Perhaps the restrictions can be modified, again, getting that injured worker back to full duty, as well as having access to PT reports to determine that, wow, we're having some great progress here. As you can see on the far right, certainly meanwhile, many of you are probably in the role of submitting the FNOL. So you're doing that part that by the time the claim gets to the adjuster, there has been a nurse contact, a physician contact, and our adjusters have access to all of that information to enable them to make even better claims decisions.
Oh, thank you, Sherry. And many of you probably know FNOL stands for First Notice of Loss. It's a common acronym. In this industry, there's tons of acronyms, but one of the takeaways for this particular slide that we'd like for you to just think about is the old model, this whole timeline was days before sometimes the injured worker was receiving treatment. And really much to the credit of GMA and Brenda really spearheading this, wanting to offer something better to the members. You can see the time frame is a day or less, and we'll have a video to show you it can be in minutes too, that they're receiving the right type of care at the right time. Now, Brenda, I think you've got a question to ask the audience regarding a visit to a brick and mortar, is that right?
Yeah, so all of my members out there, what is the average time it takes to get them into a brick and mortar physician? Does anyone have any idea how long that usually takes?
Looking for, this is where you type in your answer. 72 hours, Diane said. 72 hours plus. See if anybody else has any comments.
And this is the average wait time in a doctor's office before you're seen.
Wait time, what, 72 hours to be seen, then how long do you think they actually wait once they get there?
45 minutes, Blair says. Anybody else got any thoughts? Good interaction.
Well, let's talk about
30 minutes, 1 hour, 30 to 45 minutes.
I wish that was the case, don't you, Brenda?
Go ahead, Brenda.
Okay. Well, we talked about this when we were looking at this program because especially not everybody has a doctor that's within a couple of miles of their home or their work. So we were looking at this and the location of their job site or their home, it just depends. From talking to members the last year before we implemented this program, they're telling us that the average wait time is around 2 hours from the time they leave the office or the work location and are actually seen by the doctor. So we got to thinking about that. Well, that's a long time. I don't know how many of you out there want to sit for 2 hours in a doctor's office. I certainly don't. So we looked at telemedicine because it has a quicker response time and people are just, it's easier for them to get in, get a visit and get back to work. So let's talk about this. It takes about 30 minutes on a telehealth visit.
Just simply have a question. So
Okay.
we asked, can this be listed on the official work comp panel?
We don't recommend it be on the panel, but we have posters with that information on it. So if you need posters, send me an email and I'm happy to send some out to you. We have a separate poster that talks nothing about the 24/7 nurse line and the telehealth, but we can get those to you. So let's talk about the difference. Okay, brick and mortar, we're saying an average wait time of 2 hours. What do you think it costs? A simple brick and mortar visit, not the ER, just the brick and mortar. Anyone want to take a guess?
first of all, somebody has a question.
Okay.
Do you have any digital marketing? Anything you can send out? Probably you talked about the poster they could send. Anything you can send out digitally so they can print things off? That's what he's saying.
You don't have it digitally?
I will check the format that it's in, just to be able to post on the website.
We'll check into that.
So
Right
the-
now, we don't, but we can see if we
Yeah,
can
you can
make
see
that
that,
work.
and then during, just to let everybody know, we will be sending the presentation along with the recording to all those that registered, and then everything else, anything else. So if that's digitally, we'll send that out. But go ahead and ask your question, Brenda. Sorry for interrupting.
Okay, so on the brick and mortar, we see the visits are anywhere between $300 and $400. That's a lot of money for a visit, and then they've waited up to 2 hours to see the doctor. That doesn't include their drive time away from work. So basically, they can lose a half a day of work easily just going in, and this could be for a simple injury, nothing complex. If for some reason you want to send everybody to the emergency room, we're looking at probably $1,500 to $1,800 a visit to the ER, plus a wait time of anywhere between 4 and 6 hours. So that's a lot of time waiting and a lot of expense. So to compare that to a telehealth visit, currently the average is about 30 minutes from the time they start the call with the nurse till they're actually seen by the doctor and completed the visit. So 30 minutes of their time and a price of, under $200. So that's quite a difference in your employee's time plus the cost. That's another reason we thought it was a great idea to offer this. They're also there 24/7. So there's no longer a need to go to the emergency room because your clinic down the street is closed. They have the option to use this on the weekends, holidays, any time of the day. But you can see it's a big time saver, not to mention that money saver. So who are these doctors? Sherry?
Thank you, Brenda. So Corvell, we do own our own network. We have direct contracts with the providers in the network that are caring for your injured workers. So we do happen to know that it does take several thousand to cover a state like Georgia. We're a very large state. On the flip side of that, from a telemedicine perspective, we can cover the state with 20 providers. Now, we all know numbers don't mean everything. It's certainly the quality of the provider and their ability to really embrace the culture of GMA, of the members, and the aspects of work comp that are sometimes not necessarily embraced or known. So a lot of it is education in the brick and mortar setting. So our providers are trained on return to work. They are not dispensing narcotics, as you might have seen on the slide that Brenda had. So those are really key features of having a really condensed body of professionals that are providing treatment and really are quite nimble to be able to absorb this information that we're sharing with them. We have the ability to hold them accountable to it, and then that they are certainly able to integrate with the other services to be able to make them happen for your injured workers. So again, the focus on return to work, ensuring the right care. We are also actually building out some specialties. We're building out a Spanish-speaking practice of physicians. So again, for those members where that might be helpful, we'll have that. Looking at nurse practitioner practice groups, and even moving into the specialty areas. So one area being behavioral medicine, whereby we will have a practice of behavioral medicine physicians that the injured worker will be able to have that face-to-face with. And a lot of times we see the benefit of this when it comes to pain management or transitioning someone off of narcotics and onto perhaps even over-the-counter drugs, where a mental health component and an ever so concrete period of care is absolutely critical, but some folks are just not comfortable seeking that out in the community. So by offering it through telemedicine, we're able to break down some of those barriers.
Thank you very much, Sherry and Brenda. So at this time, we'd like to queue up a video, and I'll talk a little bit about the video, what you can expect. So imagine that one of your injured workers has called the 24/7 nurse, And as Brenda highlighted, that could be an 8 to 10 minute episode, and the nurse is now recommending it's time, we're going to send you over to a telemedicine visit. Now, please know that it's not forced. If everything is right, they're going to proceed to that. And because Corvell has done over 10,000 visits, we have learned a lot along the way. One of the things that you're going to see in this video is we've added support. So once the nurse hands it off, the injured worker, to the concierge person, that person is going to make certain, okay, do you have the right type of equipment, a phone that has a camera, or are you in a quiet place in an office that you can talk about medical conditions? How's your time? Can you do the appointment at 10:40? It's 10:15 now. The doctor can see you then. So what we want you to think about is imagine that you're actually walking into a doctor's office and you're filling out paperwork, but we're going to be doing it virtually. So that way you can kind of get the sense and feel of it. This video is probably 6 to 7 minutes or so, but it will give you a taste, and it'll talk about all the mechanics and the logistics that your injured worker would have to go through, and really the good outcome. So Dan, if we can get you to maybe go to the next slide and cue up the video.
Thank you for holding. Am I speaking with Mr. Bill Neer?
Yes.
Again, thank you for holding, Mr. Neer. My name is Kiki, and the nurse has transferred you to me so that I can set up your initial medical evaluation with a physician to review your work-related injury. Again, thanks for holding. I want to verify that I have your name spelled correctly in our system before we continue. I have your first name, Bill, spelled as B like Bobby, I as in igloo, L as in lemon, L as in lemon. Is that correct?
That's correct.
Great. And your last name, Neer, is N as in November, E like Echo, R like Romeo.
That is correct.
Great, great. Well, Mr. Neer, I also want to verify that you are employed by Georgia Municipal Association.
That is correct. Well, with the city of Griffin.
Okay, yes, I do see that. City of Griffin. Thank you. Thank you. Now, the nurse has recommended that you be seen by a telemedicine physician. What that means is simply a very convenient way of having your initial evaluation. What I would do is simply send you an email to your personal email address. And once you check it, you would open it up, download an app to your digital device. It could be a smartphone, a laptop computer with a forward-facing camera, or even a tablet. You simply need a strong Wi-Fi connection and a private area. Is that something you'd like to pursue?
Yes, I think so.
Great, great. Well, let's get started. I simply need initially your personal email address, please.
Absolutely. It is my first name, Bill, _ last name, Neer, @corvell.com. That's C as in cat, O-R, V as in Victor, E-L.com.
Oh, thank you for spelling that for me. Let me spell it back to make sure I have it correct. We have Bill, B-I-L-L, _ Neer, N-E-E-R, @corvell, C-O-R-V like Victor, E-L.com.
That is correct.
Great, great. Okay, well, let me go ahead and start by entering your information into the other system, and I'll send you that email. Let's see. Okay, well, first, allow me to verify, please. Would you give me your date of birth once more?
It is 3/11 of 1971.
Okay, let's see. That's March 11th, 1971.
Correct.
Okay, and I'm going to enter in your email address, Bill _ Neer @corvell.com. And Mr. Neer, we schedule these appointments every 15 minutes. Now, since you're on the East Coast, it's 10:20. Would you like for it to be scheduled at 10:30 or 10:45?
10:30, I think.
Okay, that'll give us time to download and answer some questions. So let me go ahead and get you set up for your initial visit. And I'm going to send over to you the email. Would you please let me know when you receive it? You'll want to check your spam folder and your inbox. If it's not in your inbox, you'll need to transfer it from your junk mail folder before opening it. Could you check that for me?
I absolutely will. Thank you, Kiki. I just received that email.
Oh, great. What you'll want to do is open it all the way up and you'll see a blue box that says Get Started. Please click there.
Thank you. Okay, it's directing me. Since I have an appointment about to begin.
Oh, yes, go ahead and click Continue or Get Started. Now, it should direct you to log in and put in a password. Your login is going to be your email address that you've given me. And you'll simply need to create a password, complicated as usual.
Okay. It's logging me in. Oh, there we go. It's
Now,
asking for a phone number, it looks like.
yeah, sometimes I've already entered it for you, so it may be in there already. If it is, go ahead and click Continue.
Thank you.
Now, the next screen is going to ask you what you'd like to discuss today. It may be one of the categories, or you can simply click Other and put in a review of what you want to talk about.
Thank you.
You probably just need to click the privacy practices afterwards and then continue.
Okay. Now it's giving me some medical history questions.
Oh, yes, it's going to have lots of conditions for you to choose from. You can go through and click upon anything that pertains to you, but if not, just go ahead and go down to the bottom, look and see if there are any allergies that pertain to you, but especially important is the medications. If you're currently taking anything, please go ahead and list it for the physician.
Okay, you take one for blood pressure.
Okay, so please go ahead and list that, click Add. The vitals you may not know, so it's no problem. Just click upon the health summary if it's not already chosen for you, and you can click Continue after that. Now, the next screen is probably the last one we'll see. It's going to ask you for a pharmacy. If you have a pharmacy that you frequent, just put in the zip code, and it'll bring up a list of things nearby.
Okay, well, look at that. It sure did. This is the one that I use.
Oh, great, great. It might have a map or listing. Click the one you use and then click Continue. May take a few moments. It's going to ask you to launch a video. Go ahead and do so, and it'll tell us about the telemedicine process.
Thank you. It's actually through a means to switch apps.
Oh, yeah, just go ahead and click Yes. Now, video is going to launch, but before we listen to it, I need to give you another important phone number. So it may be a little loud. Go ahead and lower your volume for me, and I'll give you that phone number if you have pen and paper ready.
Okay, absolutely.
Is that video starting up?
It is, yeah. Young lady in the video.
Yes, yes, she's a young lady, and if you could just put it on mute.
Okay, thank you.
Great. Just let me know if you have a pen. Yes, this is a virtual waiting room, as if you were sitting in a waiting room. The doctor is going to start speaking with you after this video for your visit. So before you continue with the physician, let me give you an important number. This is a concierge, telemedicine concierge team, myself and my associates who are available to answer questions after your visit. We're here 24/7. So you can call anytime you think of anything to ask us. Just give us a call at 800-826-3882. Okay?
Thank you. That was 800-826-3882.
Oh, perfect. Great. Do you have any questions for me right now before I let you go ahead and start your visit?
I do not, so I just wait here and the doctor picks me up from here.
Yes, sir, Mr. Neer. That's exactly what happens. And you speak with him as if you were in his office, telling him everything about the incident and your work-related injury, and then give us a call if we can help you in any way.
Very much, Kiki. This is incredible. I appreciate your time.
Well, thank you for allowing us to help you. We hope that you feel better soon and you take care, sir.
Thank you.
So in this video, just to kind of recap, what you saw was basically the concierge person taking the injured worker through all these steps. And as I mentioned before, we've learned a lot along the way. Before, we didn't have this concierge person. And so 50% of the recommendations to go to telemedicine were dropping off because people were getting frustrated. And so that's why Corvell implemented this bridge and someone who's kind of an advocate, because you can know when you're trying to sign into a site for the first time, it could be frustrating or it could be a little intimidating. So we want to make certain that you know that your members, the injured workers, have this person who's going to take them through this whole process as well. So if you liken what you just saw on the video to walking into a doctor's office, checking in with a receptionist, they usually give you a clipboard, you're filling out your medical health questionnaire and information, and then you walk back and give it to them. And then typically you're sitting there for a while before you're actually seen or asked to come into the doctor's office. So that is the piece under 8 minutes, typically. That is what it takes. And you saw that depending on the time that the injured worker chose, they may just be waiting in the virtual room for the doctor to come in. So that's that piece. And now we're going to move to the next slide, which is actually a video of a telemedicine visit, which is taking place in the setting of a corporate office or a private office. So we'll let you get the look and feel of that as Dan plays the next video.
Based on what I've heard from you today, I suggest you seek treatment with a physician. Now you have a few options. One includes an evaluation through a telehealth virtual visit. Would you like me to connect you to a physician right now?
Yeah, that sounds convenient.
Okay, great. I'm going to send you an email. Just click on the link and you'll be able to connect to our physician.
Okay, let me check that. Let me see the email. Let me click on the link. Let me click on the link and it looks like I'm in the virtual room now.
Okay, great. The doctor will be with you in just a few minutes. I'll stay on the line until you are connected.
Okay, wonderful. See Dr. Antel now.
Okay, good. Have a nice day.
You too.
Hi, it's Dr. Antel. Nice to meet you.
Hi, doctor. How are you?
Good. So I see here from my notes from the Corvell nurse that you injured your shoulder.
Yeah, correct. I injured my right shoulder lifting some boxes in the warehouse a couple hours ago.
Okay. And are you in pain now, or is it only with certain movements?
Not at rest, but like if I actually pick up my arm a little bit, it does kind of hurt, like right in the back over here.
Okay. So we're just going to pretend that you're in my office and I'm examining you, but you're going to actually be helping me.
Okay.
Okay. So if you could just feel with your fingers along here and tell me where it hurts. And then if you could just put your arms forward in front of you and just lift your arms up over your mouth and tell me if anything hurts.
Oh, yeah, that hurts right there.
All right. So from what you can so far, it doesn't seem like it's anything serious. It doesn't seem like it's a pulled tendon or ligament. If you tore anything, I think it's just a muscle strain. I want you to start some ibuprofen, 200 milligrams, take 2 or 3 tablets at a time, 3 times a day. I'll be submitting the physical therapy referral to Corvell now, and someone should be contacting you within the next 24 hours to schedule the appointment for you.
Oh, okay. Thank you, doctor.
Do you have any other questions?
No, that's it. Thank you.
Okay, you take care. Have a great day.
You too.
Bye.
So that brief video showing what a virtual doctor's office kind of feels like. The pictures and discussing it can be one thing, but when you actually see a video of it, it kind of crystallizes it. So we hope those 2 videos kind of leading up to the doctor's visit and then the actual virtual visit kind of helped you kind of get the sense what it would be like for your injured workers to go through that. Now, what we're seeing so far on our telemedicine visits, that 40% of the individuals that see a telemedicine doctor, they're staying at work. Now, you saw in that last video, it was in an office where this individual was taking a call. It could be in the privacy of a car if someone has a phone with the right type of camera. We have some members and clients that are setting up designated rooms, I'll get that word out, designated rooms for these type of private conversations. Now think about this, what is amazing about this service is how many of us can dictate when the doctor sees us. That's what happens in telemedicine. We're saying we want to be seen at 10:40 and the doctors are all waiting to see us. That's far different than from sitting in that doctor's room on that table, kicking your feet, looking at your watch, waiting. Seems like the doctor walks in, he or she's there for 2 or 3 minutes and then they're out the door leaving information. So the next screen really talks about the patient satisfaction rate. And maybe I'll throw it to Sherry to talk about what that score really means.
Thank you, Scott. So this is on a 1 to 5, with 5 being the highest level in terms of rating the provider as well as the overall experience. In that we do own our own network, the care received from providers is critical for us to obtain. So we're able to do this on the brick and mortars for any of your injured workers that are using the MyCare app. There are opportunities to rate providers on the MyCare app, but as this telemedicine visit concludes, there is an opportunity, and I think we see that with a lot of services anymore. Just a very brief survey, as you can see, of these 2 questions, and the median score is pushing 4.8. So brick and mortars tend to be in the 3s. So definitely we are seeing a much higher response in terms of just the overall satisfaction with the care and the experience itself. Just so you know, any score that is a 3 or less, we are following up on those. So we want to be able to understand what drove that and are there changes that we might need to make in the procedures.
Well, thank you, Sherry. So yeah, 4.8 out of 5 being the highest is so far it's pretty good rating, and it's nice that the injured worker can do that survey, not under duress. They can do it whenever they want to, and we get that honest feedback. I might like to pose a question to the audience. Has anyone experienced a telemedicine visit, either group health or through other means in a different setting, and was it a good experience for you or a bad experience? Just love to see if there's any exposure to this type of treatment.
Any feedback? Anybody have any feedback on telemedicine?
Have you had any family members experience it?
Not much feedback
Okay.
at this time.
All right, well, no problem. Well, we don't wish that you have to do this, but in case you or any of your valued team members have to, we just want you to rest assured that it will be a very good experience. And again, we're excited in 5 years from now to talk about, the outcomes, what's going to happen. And of course, with GMA and with Brenda, we will be refining the process to make certain that that score even goes from 4.8 up to 5 would be our goal with all the members as well. I'll go to the next slide here. Dan, I don't know if you can advance it for me to the next slide. But if you've ever had any symptoms going on with yourself, I mean, any of you out there Google your symptoms and try to figure out, hey, what's going on with me? I was interested or very happy to find out there's actually a word for that. It's called Cyberchondria. So if you're trying to figure out all the conditions you have, that's what they call it now, Cyberchondria. And the reason I bring that up is if an injured worker, or even us for that matter, if you don't know what's going on with you, you can start to think the worst. And so as you look at this slide here about the benefits, immediate access to care, so that the members know that they're being cared for immediately. Because how reassuring it is to talk to a medical professional and to kind of walk you off the ledge and say, no, you don't have this bad of a diagnosis. This is what you have, and we can definitely take care of you. So we're changing really the outcomes from the very beginning by having the access. You saw how the other video showed that they can do a pharmacy and get prescriptions if needed. And then ancillary services, meaning if they need a physical therapy, if they need to be seen for MRI, all of those things are taking place. But as you can see in this picture, it's been a positive experience. It keeps the employees engaged, and they know what they're dealing with, and they're remaining happy in the workplace as well. So I'm going to flip it back over to Sherry and Brenda here for the next slide. And Dan, if you can go to that one, and Brenda, I'll hand it over to you.
Okay. One thing I did want to mention, and we kind of mentioned it in the beginning, this is an option for employees. It's not mandatory that they have a telehealth visit. And one reason someone asked about putting it on the panel is it's not anything that takes away from the panel. So an employee can try the telehealth. If they decide it's not for them, the panel is still there for them to choose a physician. It doesn't take away any of their choices. It doesn't keep them from having a panel visit or even a second opinion on the panel. It's just an option that we're making available to employees out there. We think it's a great thing for especially small towns who don't have doctors nearby. But just to be able to have access to treatment, even though it's remote visit, it just immediately, I think, speaks volumes for the employees to know they can get treatment that quickly, no matter where they live and no matter what time or day that it occurs. So you can even use this during the workday. It's not just limited to after hours.
And Dan, could you go to the next slide for us too?
There are opportunities for follow-up as well. So when appropriate, let's say the physician orders a couple visits of PT, those PT notes are coming back to the doctor. They can schedule a follow-up. We generally will not do more than 3 telemedicine visits. But we all know that if someone goes to an Ahmed clinic, there might be a follow-up there. We can certainly make the transition to a brick and mortar, but if appropriate, and certainly if the injured worker is interested in continuing the care, they can have a follow-up, the first or second follow-up for a total of 3 visits. And generally speaking, then their case would be closed, they would be recovered. All of that information remains in the system, is always available to the adjuster. And of course, the adjuster will be working closely with you when it comes to accommodating restrictions, et cetera. But it really is a wonderful opportunity to keep the injured worker at work.
Well, thank you very much, Sherry and Brenda. And this really brings us to the conclusion of this presentation. And so just wanted to kind of recap a little bit. When you go back to the very beginning when we talked about the technology platform that's out there, there are so many benefits to really embracing this service. But what we want to make certain that you know that this team here, we are going to continue to look at ways to innovate and to bring practical solutions to affect better outcomes. And I may have misspoke, there might be another slide or two. Dan, you want to hit one more?
In many ways, we.
Oh, yeah, we talked about that one already. So I was right. We're all landing this thing, but maybe at this time we could ask if there are any specific questions. I think we have a few minutes. We'd be happy to either try to answer them now or research them and get you an answer.
Any questions? This is the part where you guys participate. Let's see what we got. Stacy, are you out there? Marcus has a question. Is there a price chart for service?
There is not. We use CPT codes that are standard in Georgia and a reduction from there. So it would depend on the visit.
Great question.
Yes.
Stacy Gilmer, are you out there? See. Stacy, are you out there? Can you hear me? Linda, are you out there? Can you hear me? Any other questions? Linda, can you hear me? Any other questions from anyone else? Nice things you'd like to say. You like the color of their outfits today? Bright and sunny, sunshiny smiles, things to that effect. Shauna says, thanks. How many doctors are on call, Marcus asked. That's a good question.
Marcus, we will need to research that at any given time. I would not be able to tell you how many doctors are on call, and I would venture to say that we are continually adding as well to be able to have those reduced wait times, but we'll get back to you.
We have great information. Again, Marcus says, okay, thank you. So thank you all for participating. Again, it was a great webinar, and hopefully you learned all the stuff you have. If you haven't, I got the information. You're definitely welcome to send me an email, send Brenda, send others. I'll also be sending contact information. I'll be sending the PowerPoint presentation along with the recording of the webinar and along with any posters or marketing materials we have. So if you don't have any more questions, we're going to let you go. When can we receive the presentation? Marcus says, I'll more than likely have it to you on Friday or early next week, depending on when I get the recording completed. So great question, Marcus. You get the gold star for being interactive. Please send me some information. Also, I'll be sending to everybody that's registered for the video. So you don't even have to have participated today. If you registered, you'll be receiving it. With that said, thank you so very much and have a great rest of the day.
See you guys. Thank you.
Bye.